Now, time to talk health and time to talk the ABCs of STIs with Dr. Kelvin Owusu, who's joining us this morning. Morning, Doc.
Good morning, Kokui.
Good to see you.
Good to see you too.
Yeah, been a while, but
it has.
we know we're going to get some good education from you this morning.
I hope so too.
Yeah, on sexually transmitted infections. Now, you know, recently we heard some disturbing news about HIV and the fact that numbers are going up, particularly with the youth, which tells us that we're not doing well in some areas, or somehow the communication has lapsed and people are doing what they want to do, without thinking about some of the repercussions of that. But let's break down STIs, the ABCs, as you put it.
Okay, well, I mean, in the past, we used to call them STDs, sexually
Yes.
transmitted diseases, but
Yes.
now we call them STIs. And the reason is very simple. When you call them a disease is established, after an infection has overpowered your immune system, but when it comes to STIs or sexually transmitted infections, you can actually infect somebody else without you yourself necessarily demonstrating any symptoms of the disease. So if you wait for a disease before you make a diagnosis, you may have done more harm than good, because that individual may have actually infected other people around him or her,
Right.
way before he or she they begin to show symptoms. Right. So that's why there needed to be a change in approach, from STDs to now STIs.
Okay.
And doing that it widens the net as to how many people we can actually bring in and help them, treat them or educate them so that they can protect their partners as well. So it's very, very important. You see, and as the name implies, sexually transmitted. You see, sex is a very intimate contact between two people,
Right.
So STI is an infection that is spread or transmitted through sexual contact or contact with any sexual fluid. You see, so it's very, very important that we make that distinction so that people will understand that it's not necessarily just the act of having sex that puts you at risk of an STI. Coming in contact with any form of sexual fluid can also give you the STI.
So whether it's oral or whether it's an orifice that could be used in a sexual manner, you can get infected.
If you actually stretch it, contact can even give you a form of infection or infestation. I mean, typical example, pubic lice. Yes, it's actually been put into the category of STIs because by having contact with the pubic area of somebody, the lice can jump from one person to the other person, and so you can now develop pubic lice in your genital area just because you had sex with somebody who probably doesn't keep their nether regions clean enough.
Right. Oh, goodness.
So it's very, very important,
Now, when it comes to STIs, let's look at the Ghana picture. Now, we've spoken already about HIV. We've seen a bit of that. Which other areas of concern are there for you as a medical professional?
Well, I mean, HIV is kind of like, it's up there, you see, because it's a viral disease, which means that we don't have a cure. And in spite of a lot of research, a lot of funding, we still don't have a cure yet. So it's something that a lot of people are still afraid of, which makes it quite unusual that in spite of the fear of HIV, and the numbers are going up. I think COVID didn't help in that regard because a lot of attention was shifted from malaria, HIV, even cholera, and shifted to COVID. And so in that sense, there was a lapse in communication, there was a lapse in monitoring, and that's where the numbers are going up. You see, but HIV is still real. It's a sexually transmitted infection, and it can actually be passed on to your children unborn as well. So you really need to protect yourself from HIV. And it's one of the difficulties with HIV is that from infection to disease, to demonstrating signs and symptoms of the disease, it takes a long while. It can take up to 10 years. Right. You see, so that's part of the reason why a lot of people still doubt that HIV is real. Which growing up, there were so many adverts about personal experiences that if you still don't believe HIV is real, I don't know what you are waiting to see. But related to HIV, there's also hepatitis B and C in particular. Hepatitis B, thankfully, there's a vaccine against hepatitis B. So if you have not been vaccinated against hepatitis B, you really need to find it and get vaccinated. Hepatitis C is also out there. We don't have a vaccine against that one, but it is still a viral infection that can be spread through sexual contact. There are other ways of getting these HIV and hepatitis B, hepatitis C, for instance, through blood transfusion and even sharing food to an extent, so you want to be careful with that one. However, the commonest sexually transmitted infection is actually one that most people may not even be aware of. It's called HPV.
Human papillomavirus.
Yes, it's actually the commonest. And in America, I mean, the data suggests that about 80% of sexually active people have at least at one point in their life contracted HPV.
Whoa.
So it is that common.
It's that common.
Thankfully, the body is able to deal with most of it. However, a few, I mean, it's always the case. A few people would not be able to deal with it, and then they would go on to develop cervical cancer,
Right.
which is actually now classified as a sexually transmitted. Yes, it's
yeah.
a cancer that affects women around the cervix. The cervix is the part of the woman that holds the womb closed for the baby to develop. You know, and a cancer can develop over there, which is caused by this HPV.
Right.
And so if you contract it and your body is not able to deal with it, you can in the future. In fact, there's a high chance that you will develop cervical cancer. So it's something that you must protect yourself against.
Okay.
If you don't get,
we're going to show people some images as we're talking. So we just want to say that viewer discretion is advised. Some of these images may be disturbing for viewers. So if you're a bit sensitive, you can look away. But it's educational. All right. This is all for us to educate the public about what we're discussing, which is sexually transmitted infections.
I mean, I think it's good to shock people to make them see that it's actually real. I mean, there are people who are struggling, who are walking around with these things, and most of them were preventable. You see, so I was making a point that the HPV is also responsible for genital warts, which are growths in the genital. In fact, there can be growths in any part of your body, but usually starts in the genital area. You know, outgrowths on the penis or on the vagina, the labia. You know, it's quite unsightly. You know, and it's a result of this HPV.
Okay, what are we looking at
This
here?
particular one we are looking at is herpes. Herpes, genital herpes. It's another infection. And you know the interesting thing, so there are two types of herpes. There's herpes that comes on the mouth, and there's herpes that comes on the genital area. And in the past, it was easy to tell the two apart because one stayed at the top and one stayed at the bottom. Now, because of, you know, all these sexual practices with the mouth going to areas where it's not supposed to go, now there's a mixture, so it's difficult to tell which is which. Okay. So this is herpes. Whether it's type 1 or type 2 is not important. It's herpes. And the thing about herpes is that it flares up and goes down depending on your immune status.
Right.
You see, so let's say you're about to develop malaria, your immune system is already challenged. Then you see your herpes will flare, and it is most infectious when it flares. You know, so when the blisters are evident, they are there, then they are infectious. So if you are going to have sexual contact with anybody and you notice that there are blisters on the mouth or in the genital area, stay away because you will contract it. So you don't want to put yourself in that situation at all.
Is this why we've heard people shouldn't kiss babies because, again, babies, their immune systems are now growing, and you'll hear people say all the time, don't kiss babies because of this HPV. You never know, you could give it to a baby and it's
I mean, there are so many reasons why you shouldn't kiss a baby, but I mean, they are so adorable, it's so difficult.
I know, right? Good. I used to be crazy with that. Don't kiss my child. No, stop it. Don't kiss my child. But there are reasons why.
This is one of the reasons why, because it's transferred. It can be transmitted through any body fluid. So I mean, if you have a blister on your mouth and you go and kiss a baby, you transfer the virus into that baby, and then that's it. It's a lifelong infection. There's no treatment. There's no cure. You can limit it a bit, by taking some medication, but it will still come up the next time you are going to get ill. So typically you see it in people, I mean, and it's quite common. Many people have herpes infection because it's transmitted from mother to child most of the time. By the time they come out, they already have it anyway. So you notice it typically when somebody's about to get malaria. So for some people, they will tell you that sign means that I have malaria. But actually, it's not malaria. It is herpes. You have herpes. So I accept it now.
Okay.
Maybe it didn't come from sexual contact, but it is still herpes.
Okay. All right.
So deal with it. Like I said, there are medications that can help control it, limit it somehow, but cure is not possible because and it's the same with a lot of viral infections. You see. So we've spoken about HPV. Now HPV. Let me go back to HPV because I mentioned it can cause cervical cancer. It can cause genital warts. In men also, it can cause some form of penile cancer as well. So it's not only a female concern, it's also a concern for males, But generally speaking, women are more at risk of STIs than men are. It's one of the many things that women are disadvantaged.
I mean,
I know,
there's
right?
so many. And this on top of all of that, STIs as well. But I suppose it makes sense.
Yes. You see, this is because the whole, the sexual act itself, you know, is traumatizing for the
female genital
area is quite traumatic. And once there's trauma, once there's some form of trauma, there's bruising. That means that the area, the skin or the tissue in that area is not as intact as it was. I mean, there are small openings in there, and once there are small openings in there, the body will try and control it by sending, you know, more blood over there. So that's what something called inflammation. So you notice redness. If you bump your hand against the door, you notice redness. That's the body's way of trying to limit the spread of the whatever unfortunate incident has happened. Now, in that regard, any virus or any pathogen in that area has easy access into the blood, and because the blood there is plenty, now it means that the blood is able to carry a lot of the inoculating dose away, you know. So this whole process I've described makes women more at risk of catching an STI than a male would be. So if you expose, what I'm saying is that if you expose a man and a woman of the same health status, they are both healthy, you know, young adults, and you expose them to HIV, HPV, whichever V you can think about, the female would catch it easier than the male would, which means that females should even pay more particular attention to their partners. You see, because, and there are men who have had sex with HIV positive women who actually did not get the virus because of what I just described, because they are not as traumatized as the woman is, you know. So you as a female, you need to be extra cautious about your partner. You know, of course, I'm not in any way saying that men can go and do whatever they want. Not at all. But I'm saying that as a woman, don't expect the man to look out for you. You need to
look out for yourself.
You need to look out for yourself.
Yeah. Take control over your sexual health.
Very, very important.
Okay, we're going to be looking at more images. Again, viewer discretion is advised, but this is educational imagery to teach us about sexually transmitted infections. So let's see the next image. Okay, so Doc, what do we have here? So
this is an example of genital warts. You know, so I mean, when you look at the male, and this is actually in a male, and I know because I found this image, so I can tell. Okay. Now, when you look at the male penis, yes, the skin is a bit, you know, it's not too pleasant to look at. But if you focus on this one, you can tell that there's some extra, you know, something extra going on, some multiple areas of some roundish, you know, elevations over there. Now, you need to pay attention because this is a sign that this person has HPV. So if you have sexual intercourse with this person, as a woman, and as I've just explained, you are going to catch HPV if you have not already caught it. You know, and so you need to pay attention to some of these things and make sure. And this is why you should probably not be having sex in the dark, really, because.
but Doc, okay. So quick question though. I mean, this, I'm assuming, is on the shafts.
Yes,
of the
this is on the shaft.
But there are people who have very bushy areas around their genitals, right? Can some of these things be hidden in the bush? In which case you might not see it. Yes,
it can be hidden in the bush. It can even be hidden around the anus. I mean, it could even be on the back. It's not easy to pick. You may not be able to pick it up all the time, which is why you need to know your partner. You know, if you don't know your partner, then you have to use a condom because you don't want to expose yourself to some of these things. You see, could it be that the person is keeping a bush because he or she is hiding something? You know, we don't know. So you need to protect yourself. It's very, very important because once you catch it, you are going to, it's a 50-50 chance whether your body is going to be able to deal with it and get rid of it, or it's going to become a chronic infection and then end up with you developing cervical cancer. But let me also chip in that thankfully there is a vaccine against HPV. There are particular subtypes that are notorious for causing cervical cancer. There's a vaccine against it. Unfortunately, if you've had sex, you cannot take the vaccine.
Okay, so that's why it's mostly for young people.
So by age 12, 13, you should have, if your daughter is 12, 13, they should have had it already, or if they haven't had it, they should go and have it right now, because once you have sex, it is assumed that, because that's why I mentioned it's the most common STI. So once you have had unprotected sex, automatically the assumption is that you have caught it anyway, so there's no point, you know. Wow. So you need to get the vaccine before you are sexually active. Ideally in your early teens, you know, by 11, 12, 13, you should have had that vaccination done. It's also available for men, for boys as well, you know, but we focus more on the women because there's a higher probability that they would get it, so that's why the women, we talk about them more, but it's also available for boys as well.
Okay.
You know.
Now, do we still have issues with STIs like gonorrhea,
I was
syphilis.
just going to mention those ones.
Okay.
So yes, we still do. I mean, surprisingly, because they are the easiest to treat, really.
Okay.
I mean, some of them are just one pill that you literally take one pill and then you are fine.
That's it.
And
Okay.
so when we see a person with gonorrhea coming in, especially with complications, then you are wondering, how did this happen? And some of these STIs can actually cause blindness in the unborn baby. You see, so the thing about STI is that it's not just about you, the individual suffering. First of all, you can infect your partners, or all your partners for that matter, and your partner can infect his or her partners as well. So it sets off a chain reaction. And then you can also infect or affect your unborn baby. HIV, hepatitis, syphilis, gonorrhea can all affect the unborn. In fact, all the STI can affect the unborn baby. You know, so getting treated for an STI it's a national security issue. I mean, really, because we don't want our children to be born with issues. So imagine giving birth to a baby who there's a category of babies or category of infections we call torches. You know, and that is basically a syndrome of these STIs affecting unborn babies. Some of them are born with mental deficiencies because the infection, you know, obviously eroded their brain and now they can't function. And they are born. So what do you do with them? You know, it's a problem. It's a major issue. Okay. So when a woman reports to hospital with pregnancy, as part of the antenatal labs, we actually insist or we ensure that they screen for all these STIs. Right. But I see here is the challenge: money.
Yeah, lab tests do cost money.
Yes. So you as a doctor might request the labs, but would the patient do the test? That's where the challenge is, and that's why there's a lot of defaults amongst pregnant women. Okay. So a lot of them don't come back with their results, and so we never catch them until they come in to deliver, and then
there's a problem.
It's too late because the child already has a brain deficit. We cannot repair brain deficits
at that point.
So we really need the education to go out there, and we need some form of intervention either from government or NHIS.
But there's been so many campaigns. I mean, the use of condoms. We know that religious bodies frown on certain things and they try to preach abstinence. But from what you're saying, we need to go a step further. So condoms are still the best kind of protection?
Well, the best protection still remains abstinence, really. The best, the ideal is abstinence.
Thank you. Ideal, right?
Then the next ideal is to be faithful. But you see, here's
ideal.
The thing. So here the caveat. You need to be faithful to a faithful partner.
And since it's hard to police people's faithfulness or fidelity, you've got to protect yourself.
So those are the levels. So abstinence is the ideal, followed by being faithful, and in terms of both partners. And then knowing very well that ideal doesn't work in this part of the world. In fact, in the world in general, you have to go with a condom.
You've got to go with a condom. Thanks, Dr. Kelvin. Where do we find you?
On social media, Kelvin Owusu MD, or you can find my clinic page as well, Claron Health International.
Awesome. Good to see you. Thanks so much. A word to the wise is enough, everybody. Abstinence, fidelity, condom, in that order.
Exactly in that order.